Talk 2020 guidelines. So first is some risk factors. Some important risk factor is 3 or more sexual partners in the previous 12 months. If there is there, then syphilis can get. Okay, the two types of syphilis. First is early syphilis, which is primary and secondary syphilis, and latent syphilis. That means in latent syphilis, again there is early and late latent. Early latent syphilis is within 1 year, whereas late latent syphilis is more than 1 year. Okay. Then primary syphilis is there is a papule seal and which bursts and becomes a chancre, and it is a painless one. And after getting infection, we'll see these features within 3 weeks. Okay. Whereas secondary syphilis is after 4 to 10 weeks, systemic infection occurs. That is secondary syphilis. Okay. Coming to condylomata lata is a warty, highly infectious thing. There is discharge also seen. Okay. Then transmission in the fetus is 100% with the primary syphilis. 100% with the primary syphilis. It is latent syphilis. Early latent syphilis you have 40%, whereas late latent syphilis you have 10% of fetus transmission. Okay. Coming to investigations. Investigations like you'll send a 10 ml of clotted blood. Okay. If there is any lesion, from that also we'll take a swab, that is known as flock swab, and we'll see the syphilis PCR test. Treatment is benzathine penicillin 2.4 million units will give intramuscular stat dose. Alternatively, you can give ceftriaxone 500 mg IM dose 10 days. And if there is penicillin allergy, alternatively you can give amoxicillin 500 mg and probenecid 500 mg. Orally tablets can be given. These are given 4 times per day. In that way, you will give for 14 days. Okay. Coming to Jarris-Hexamer reaction. This Jarris-Hexamer reaction is something like once you start the treatment, the treponema things get released in the blood and results in fever, rigors, and rash. This is within 24 hours of treatment. Jarris-Hexamer, 90% Jarris-Hexamer lesions reaction is seen with the secondary syphilis. That is important. So 90% with secondary syphilis. Okay. And whereas 50% with primary syphilis and 25% with latent syphilis. Okay. And if syphilis comes in pregnancy, what you will do? If syphilis in pregnancy, then in first trimester and second trimester, you will give 2.4 million units intramuscular dose. Okay. Whereas if it is early latent, and if there is late latent, we will give weekly dose for 3 weeks. Whereas in third trimester, you will give this 2.4 million units, 2 weekly doses, even whatever it may be, whether it is primary, secondary, or latent syphilis. Okay, that's it. Thank you.